Okay, so I did my persuasive speech on prescription drug abuse. An estimated 15 million individuals are currently abusing prescription drugs in the United States alone. What are the most common prescription drugs that are abused? Opioids, which are painkillers such as Oxycontin, Percocet, Vitakin, codeine, and morphine. Opioids work by releasing the chemicals and the endorphins that are naturally made by the brain to block pain sensors. Depressants, which are benzos such as Xanax and Amitol, and those are used to treat panic disorder and anxiety. Amitol is used to treat sleeping disorders. Stimulants, which such as Ritalin and Adderall, stimulants are used to treat ADHD and other attention disorders, and they increase alertness, energy, and attention. So how do drugs become abused? So imagine you're going to the hospital for a routine procedure and you wake up and you're in pain. So they usually will prescribe you an opioid such as codeine or morphine, and usually the prescription is about a 30-day prescription. The responsible person would take it for a few days until they start feeling better, and then just stop taking it. The issue is when people take the entire prescription, in a 30-day period, your body can become very dependent and addicted to these opioids, which are extremely hard to get off of. So the issue is when after you can't get those prescriptions anymore, many people will turn to street drugs such as heroin to relieve their pain. So here are some facts and statistics. According to the National Institute on Drug Abuse, in 2013, 207 million prescriptions were written for opioid pain medications. And more people are killed by prescription drug overdoses than traffic accidents. 2/3 of prescription drugs are prescription drug abuse people get it from their family or friends, so they get the drugs from the people that are actually prescribed them. The United States makes up only 5% of the world's population, and they consume 75% of the world's prescription drugs. So, are doctors to blame? The short answer to this is no, but there is a lot of evidence that doctors have been writing more and more prescriptions as time goes on. In recent years, the amount of prescription drugs, specifically anti-anxiety and ADHD medications, have greatly increased. The people diagnosed with these conditions has also increased, so that kind of correlates. While doctors have the extensive medical training required to prescribe these drugs, many feel that they just prescribe them too easily and they don't go through necessary testing to make sure the patient actually requires the medication. And then this is also very disturbing. Children as young as 2 years old are being prescribed anti-ADHD medications such as Adderall. And at 2 years old, you can barely speak, and most of these children are probably just going through a phase. So I just feel that you should probably try to hold off giving your child those kind of medications that they can get dependent and addicted to for life until they can actually know if they need them. So what is being done to stop the epidemic? And recently there have been programs set up to help combat the prescription drug abuse epidemic. And these programs, which are prescription drug monitoring programs, have only been set up in about 13 states. And what these programs do are they basically monitor doctors' prescription habits. So if a doctor is prescribing a lot of opioids and other addictive drugs, then they will investigate and make sure the doctor isn't just overprescribing and giving unnecessary amounts of these drugs to patients that don't really need them. And then they'll also monitor pharmacies that distribute these drugs to make sure that they aren't prescribing too many drugs. So if the population is small, the amount of drugs that are prescribed should be small. That's kind of how they do it.